Welcome to Health Bulletin. Today we're diving into a major global issue, the evolution of how we understand mRNA vaccines. A new research paper out of Poland this year is challenging the once dominant narrative that mRNA vaccines, like those used for COVID-19, are completely safe. The paper highlights how scientific opinions have shifted since the pandemic began. We've provided the link to this article in the description. So what changed? And how are global powers responding to these new concerns? In 2020, the world was desperate for a solution to the COVID-19 crisis, and mRNA vaccines were hailed as a breakthrough. Early reports in the scientific literature were overwhelmingly positive, with studies claiming there were virtually no serious adverse events associated with these vaccines. But by 2022, that narrative began to change. The Polish study shows that over time, reports of severe adverse effects, or SAEs, started to emerge. Myocarditis, neurological conditions like Guillain-Barré syndrome, and thrombosis were among the most concerning complications. The paper suggests that early studies may have downplayed risks due to political and economic pressure. With countries competing to lead the vaccine race, there was little room for skepticism. Governments and corporations needed these vaccines to succeed, and as a result, the initial focus was on speed rather than transparency. Even though serious adverse effects were rare, the study argues that we cannot ignore the growing body of evidence that emerged from 2022 onwards. Younger populations especially saw higher rates of complications, pushing researchers to reconsider the risks of widespread mRNA vaccine use. So how have global powers reacted to this shift in understanding? Many countries are still pushing mRNA vaccines as a central part of their public health strategy, despite the concerns. The report highlights that nations like Poland and Hungary are calling for more thorough testing and regulation of these vaccines. However, the lack of a coordinated international response remains a major issue. While some health agencies acknowledge the potential risks, others continue to downplay the findings, prioritizing economic recovery and vaccine distribution over a more measured approach. This shift in narrative has had a profound impact on public trust. The paper warns that the growing distrust in mRNA vaccines could have far-reaching consequences, not just for COVID-19, but for future vaccination campaigns against other diseases. People are becoming more skeptical of scientific recommendations, and rebuilding that trust will be critical in the coming years. The authors of the Polish study are now calling for global health agencies to step up to provide clearer, more transparent communication about both the benefits and risks of vaccines. Without this, public skepticism could turn into outright refusal, derailing efforts to prevent future health crises. So, what does this mean for the future of public health? The COVID-19 pandemic brought about unprecedented scientific innovation, but it also exposed gaps in how we communicate about risks. The Polish study calls for a return to unbiased, objective scientific research, and for greater transparency moving forward. One thing is clear: if we don't learn from these challenges, we risk repeating the same mistakes in the future. Watching Health Bulletin. Don't forget to subscribe for more updates on global health and science.